Hey doctor, do you want to know about children, the child patient, when you use myofunctional therapy, when you use a trainer, myobrace, multi-appliance, when you do expansion, what approach you use for these various problems? Do you want to know why to use them and how to examine and diagnose and plan which therapy? Those are all in the phase 1 orthodontic course online. That is a fabulous course for you. Let me tell you, it also has fantastic information about not only the modalities, but how you get to it and how you present it to the parent. So those are things to think about. Also, a lot of that is also reiterated in maybe a little bit more detail in the airway course. And finally, we've divided it in the following way. There's one more course you should know about, and that's the interception ortho, eye ortho. Okay, what's the difference in interception ortho and phase 1? Because people use those terms sort of interchangeably, but let me tell you how I have defined those. First of all, the eye ortho, interception orthodontics, is actually a course about treating in primary dentition. That's it, primary dentition. And there's lots you can do in primary dentition if the need is there. And it also tells you how to figure out if the need is there. If it's not there, stay out of there, right? Okay, phase 1 is treating in mixed dentition. That's when you have 6-year molars and erupting or erupted incisors, permanent. Phase 1. And both of these arenas are those that you will be able to look at, diagnose, first through exam, then through records, then through diagnosis, the need for any treatment, either eye ortho, interception, primary dentition, or phase 1 mixed dentition. So those two courses are crucial if you want to know how to find it if it's there, how to leave it alone if it's not there, of course, and what to do, what to treat, how to address it, what to do telling the parent, what to do in working with the child. And one more course for you, and that is the actual airway course for a little bit more detailed information if you wanted to start there. If you don't start with airway course, leave it alone and go straight to eye ortho because it's in the eye ortho course as well. But if you want the airway course up front, do that first, okay? Now, eye ortho, and then phase 1, and then keep in mind that you have the option of going to the ERDTC, Exam, Records, Diagnosis, Treatment Planning, and Conference. Those 3 together give you a fantastic start for your child patients, your younger ones. Phase 1 might be at age 7, 8, 9. It might be at age 10, 11. So it just depends on your child patient's needs, okay? So how do you figure out whether you want myotherapy, whether you want trainers, myobraces, whether you want to incorporate any of the therapies addressing both airway and tooth positions and growth? Because remember, when you're looking at primary dentition, you're also thinking orthopedics, encouraging the growth of the craniofacial structures. And when you're looking at phase 1, you still have orthopedic possibility. You certainly have transverse expansion possibility. So these courses will lay it out for you. I wanted to let you know how they define. You might look at it and say, what in the world is the difference? So eye ortho, primary dentition, phase 1, mixed dentition, and then ERDTC, Exam, Records, Diagnosis, Treatment Planning, Conference, which goes along with especially phase 1, because quite frankly, the eye ortho pretty much is inclusive of that in its course. So take a look, think about what you might need. Call me if you have any questions or you're not sure what to start with, but start looking at these kids in a whole new light and change their lives and yours.